Hello everyone, welcome to another lecture for drug delivery engineering and principles. We have been talking about various kinds of strategies to improve drug delivery. For the past few classes we went into the engineering module where we are talking about scaffolds which will stay in the body for quite a bit of time. While we were doing that there were some issues and challenges that had come up, which is one of the major challenge was the implant associated infection. So, for the last two classes we discussed how these implant associated infections can be problematic. So, we talked about some of the major problems that the tissue would not integrate. So, no integration. Once they are infected, we also talked about that they will even cause damage to the surrounding. And then we talked about that there is really not much you can do because those implants are sort of resistant to the immune system. As well as antibiotics. And really the only option that comes after that is to device removal. So, whatever you have put in you have to remove it, make sure that the area is no longer containing any bacteria, and then you put another device or you take cognizance of what needs to be done with the patient. So, some of these strategies we also discussed to prevent this from happening. Of course, this is a road we do not really want to go down to. So, if we can do it in such a way that it does not happen, that will be great. So, in that we discuss some of the alternatives that we have. So, let us say for a particular application we have multiple alternatives in terms of polymers and the type of material we are using. So, we can then go ahead and maybe use the ones that have been shown to be less prone to infection than the ones that have been shown to be more prone to infection. Of course, you have to make sure that the device itself is actually useful, because you do not want to really put if you want to grow a liver, you do not want to put a stainless steel implant there just because it may be less effective than let us say a polymeric implant, just because the stainless steel is not going to do anything in terms of repairing the tissue. So, some of these things again you have to take into account, and some other strategy we discussed is to make surfaces hydrophilic. So, you can treat surface with plasma or some other options you can explore to essentially make them hydrophilic, and what we typically find is bacterial adherence on the hydrophilic surface is low. And the another strategy we discussed was to release some antibacterials on the surface. So, this could be antibiotics or some other small molecules, and if your implant is already releasing these antibiotics out in the surrounding media, then this bacteria is not able to come and attach to the surface, because this will kill the bacteria or the bacteria will just go away. So, these are some of the things we discussed in the last class. We are going to now move on to a different module in this course, and that is essentially what route you want to take for different applications. So, we are talking about route specific delivery, and again the key point here, like in all sort of modules we have discussed so far, is that the route you choose depends on the application you are looking at. So, what is the appropriate route and what is the delivery system that you are using is majorly driven by what is the application you are using it for, and we will go in quite a lot of detail about this in next few classes. So, some of the most common routes that are used for administration are intravenous route. So, that is essentially nothing but directly injecting into the blood system, injection in either veins or arteries, and I am sure you all must have at least are very familiar with this particular system. Most of the time when we are growing up we need to get vaccines. Some of these vaccines are also given in all through these routes, especially intravenous route. And then next is the IP injection, intraperitoneal, again very widely used in literature, and what it is essentially injecting it below your stomach cavity. So, it is sort of an intra between different tissue space where you just inject whatever you want to give. Then is intramuscular, which as the name suggests is nothing but directly giving it in the muscles. So, typically you can use hip muscles, you can use biceps or you can use any kind of other large muscles, thighs to inject this, just because that ensures that most of it goes in the muscle rather than anywhere else. Subcutaneous is nothing but just under the skin, it is also abbreviated as SC, and that essentially just means that you maybe lift up your skin and you just inject it below that, and so that gets absorbed through that. And then you have intradermal, which is nothing but is in the skin. So, instead of penetrating all the way through the skin, you just penetrate somewhere in the skin, so that when you inject it, it actually is whatever is given is gets entrapped in that small skin layer, through that which it can diffuse out of. So, and then there are other routes as well, there are transdermal. So, it is just something that you can just deliver through the skin, and so any kind of injection is essentially transdermal, but in this case we are talking about just right under the skin, very similar to subcutaneous route. And then you have any mucosal route, which means that that route has some kind of mucus that is experienced when you are injecting it. So, this could be oral. So, our oral cavity, our oral route is completely filled of mucus everywhere. So, there is mucus in our mouth, there is mucus in our stomach and intestine, could be intranasal. So, you can deliver things, especially if you are looking to deliver things to brain, intranasal is used quite a lot. You have pulmonary, again our lung is full of mucus and this is nothing but delivery to the lung. So, this could be either through inhalation or nebulization. Could be intravaginal, could be rectal. So, all of these routes have some sort of mucus layer that is experienced while injection or while administration. And so, again we will discuss all of these routes in quite a, or most of these routes in quite a lot of detail as we go along in this class and the next. So, these are essentially giving you a laundry list of different administration option. I mean there could be others as well. People inject, I mean you have taken eye drops and that is nothing but essentially you are giving intra optically. So, there could be other routes as well, but these are some of the major routes that are being used. So, what are the factors that influence the selection of the delivery route? So, we have already talked about application is the major criteria. So, what is it? If it is, let us say if it is a disease that is only on skin, there is really no point in giving an IV if you can give it just topically onto your skin. Similarly, if the disease is only localized to lung, maybe giving it through a pulmonary route might be better than again giving it throughout the body. Then it depends on what is the drug that you are using. So, whether the drug is going to work in that route or not. So, let us say again taking the example of the skin, let us say if a drug is not able to diffuse through the skin, then there is really no point in giving it on the skin. If you want the drug to go all over the body, there is really no point in giving it through the skin if the drug cannot go through the skin. And then similarly, so the drug physical chemical properties become important. If the drug is let us say insoluble in a pH of 2 to 5, which is what is going to experience when you take it orally, again there is really no point in taking the drug orally, because most of it is going to precipitate out. And this again involves a lot of things. So, what is the drug molecular size? So, how big the drug is essentially, what is the half life in whatever route you are giving it. So, maybe it gets cleared very quickly. How much stable it is, again if it is not stable at a low pH, or if it is not able to penetrate through the skin, maybe it gets degraded by the enzymes present in the skin. You need to consider all those factors, and whether whatever aqueous solution it experiences, this goes back to the pH, whether it causes denaturation or degradation of the proteins that you are administering it to. And then of course, it also depends on what is the desired pharmacological effect. So, as I said, if it is something that is localized to lung and you do not really want to give it systemically. Similarly, if it is something that requires quite a heavy dose of the drug, let us say if I need to have let us say grams of the drug, it is not going to go through the skin very well. Then again if the desired pharmacological effect is local, so like topical, vaginal, these are some of the routes that can come in. If you want it to be everywhere, so let us say if it is paining throughout the body or if it is fever throughout the body, you may want it to be systemic, and in that case any of these routes can be chosen. And if you want immediate response, so again if you apply something on the skin, it may take some time to diffuse in and actually reach the site where it is going to act, and so that may take some time. But if you want some immediate response to happen, the best route is the IV, because that will essentially mean it distributes everywhere in the body within few seconds, and then other routes can again also be used if you want immediate response. And again we talked about this. So what is the dose size? So if you want quite a bit of dose to be delivered, maybe you can't inhale that much amount of dose, maybe it is hard for you to inject that much dose in a muscle, then you maybe are looking at an interperitoneal route or maybe oral route. So all of this plays a role, and then of course the size which is going to define a lot of physicochemical properties. So if the size is let us say too big, it cannot penetrate through your skin layer, and so that all affects ultimately what is the delivery route that you should choose. So here is just an example of how different the administration route can be. We had talked about a similar case at the very start of the course, but let us say you have a 500 milligram dose of a drug that is either given orally or is given intramuscularly. So and to the same subject on separate occasions, and this is an actual clinical data. And so what you typically see is that the plasma concentration of the drug is being reported here with time, and what you are seeing here is when you are giving intramuscularly, you get a very high plasma concentration, and the peak is also a little earlier than when you are giving it orally. So this is the peak for oral, this is the peak for intramuscular. So first of all you see that there is a big difference in the peak value that you can get, and then secondly you can see that there is a time difference also. So intramuscularly is able to have a lot more concentration of the drug at an earlier time point than let us say a oral. So even though the same amount of drug is given in, you see differences. So that is why it becomes very important to choose a good route before you start your procedure. And again these biological barriers will affect the drug absorption. I mean obviously we have discussed this previously that the oral route has lots of challenges. The drug get destroyed in the gut, there is absorption, then there is a first pass metabolism. All of these things will lead to lower amount of drug being present when you give the same drug orally compared to intramuscularly. And then methods of delivery are important. So whether it is going to be implanted or it is going to be some other route. So if it is implanted, you are looking at a big implant, by big I mean something that can be used for a surgery or something like that. So you are looking at some macro device, or this could be injection. So you know you do not really require a surgery, but you would still require some sort of procedure to be done. This could be small particles, so again micro and nano. It could be free drug actually, which is what is currently done very widely in the literature, or this could be in situ gelling polymers. Let us say in situ gelling hydrogels, which once they go in they will form a depot at that site. So or this could be again implantation, which will essentially involve surgery. So all of these factors need to be taken into account when you are trying to develop or trying to administer a particular cure to a patient. So let us talk about oral administration, one of the most widely used method. So what are some of the advantages? One of the advantages, it is very patient compliant. So again we have all taken things orally, we have all taken drugs orally. So all you have to do is just take a tablet, drink some water, and you are done for that particular time. So it is a very high patient compliant, very non-invasive method. The manufacturing facilities are well established. I mean this has been done for now several decades, and there is quite a lot of literature and quite a lot of industry based setups that can help you produce these tablets in very mass number. So, that is always good, because then you can take your cure to a lot more population. What are some of the disadvantages? First of all, an unconscious patient cannot take it. So, the patient is not awake, it would not be able to swallow or eat it. It has fairly low solubility, it has to go through very different ranges of pH and all, low permeability. So, even if you are able to get to your gut, not everything is going to get absorbed, some of it is just going to get excreted out. A fairly harsh environment, so there is lots and lots of enzymes that are present, that is going to cause it to degrade. There is low pH as well. So, all of these are an issue. Then you are talking about first pass metabolism, which is basically liver, even before it gets circulated into the blood system, most of your drug may get metabolized by the liver during the first pass metabolism through the hepatic portal vein. Then you do not know how it interacts with the food. So, maybe if you have just eaten the food, the pH is different, the environment is different, there are less enzymes, whereas if you have not eaten the food for past 2-3 hours, then you really have no food in your stomach and your intestine. At that point, the interactions on the food will be fairly variable, and that is a problem, because then you do not know how much of the dose you have given, whether the dose you have given is lower than what it should be, whether it is exactly what it should be, or whether it is much higher and you might reach toxic levels with that particular dose. And then of course, there is irregular absorption, so it is fairly variable, that is the major problem here. So, again here are some of the traditional oral delivery systems. So, I am sure you have seen all of these. So, you have tablets, one of the most widely used, you have capsules, you have gelatin capsules as well, which are slightly different in characteristics, and then you have suspensions like cough syrup and things like that, that you have directly ingested. And so, typically to form a tablet, some of the traditional formulations is extremely cheap and rapid to manufacture and package this. It is in dry formulations, it is typically very stable. So, that is one of the advantage of a tablet, that you do not have to worry about it, it is all dry. Typically you will find that the biomolecules, when they are in water, they are more prone to degradation and losing their activity than when they are in a dry format. The patients recognize it, accept it, so the patient compliance is fairly high, and it is all in, and there is all kinds of processes that are present in there. And then there is a taste masking process as well. So, if let us say your tablet is extremely sour or something that is not a good tasting tablet, then you can mix some good tasting molecules in there, so that your taste can be masked, and actually patients are okay in taking that tablet through oral route as well. And so, it involves obviously two major components, one is the drug itself, so whatever drug you are giving, and then the next is the excipients. So, this excipients could be of several types, this could be dilutants to sort of make it bulk. Let us say if you only require a microgram of drug, then they can't make a tablet out of a microgram of drug, because that microgram of drug will not be even visible if they make a tablet out of it. So, what you do is you then make a tablet which contains this microgram of drug, and everything else is sort of a filler. So, it could be a dilutant, it could be a binder, it could be a glidants, anything in that sort, or maybe you want to give some more functionality to it. So, you are adding some antioxidants to it as well, so the patients are more likely to take them as well. So, here are some of the examples. So, you have diluent, which is essentially is a bulking agent for low doses, as we just talked about it, and here are some of the major compounds that are being used as diluents. So, it could be salt, it could be sucrose, it also improves the taste, lactose, cellulose, all of this is actually used as diluent quite often. And then you have binders, and what do we mean by binders? So, essentially if you just put salt, the salt is not going to form a tablet. So, you have to put some things in there that holds the whole tablet together, so that improves the cohesiveness of this powder. And again there are several examples of this, you have starch, PEG and several other molecules that can be used for this. Then you have lubricants. So, lubricants are not really required once the tablet is formed, but before the tablet is formed you need these lubricants and these glidants which will help in the flow of the powder, and this is required because when the tablet is being formed, the tablet is essentially first in powder form and then this powder is flowed into a sort of a mold. So, maybe if let us say this is my reservoir of the powder, it is then flown through some nozzle into a mold which is going to take the form of a tablet. But for it to flow well, because you do not want this solution to be this powder to be very sticky. So, for it to flow well, you need to add these lubricants and clearance, so that it can be rapidly scaled up. Then you have disintegrants. So, essentially once you have taken it up, you want this tablet to break up very quickly. So, you want something that once it goes into the stomach environment, it either dissolves away completely or breaks down completely. So, you then add those things as well. And then of course, there are flavoring molecules that we briefly talked about. So, maybe you want to improve the taste, maybe you want to increase patient compliance, especially in children. You want to add coloring agent to help companies distinguish as to which product is for what application. So, all of this can be then adapted. So, here is briefly what I was basically talking about before. So, here is a typical tablet machine, and you are using some compression and filling to form these molds, and this again, this technology has been used for quite a bit of time, and it is very well established up to the fact that you can make 1 lakh tablets per minute. And so, in terms of scale up, this is not a problem at all. And then a similar thing for capsules, their composition is again very similar to tablet, but they are not compressed. So, if you have ever opened the capsule, you realize there is some free powder there is. So, it is a free flowing powder within either a hard or elastic shell. Obviously, the manufacturing cost goes up because now you are using quite a lot of material, and it is a little more cumbersome than let us say a tablet which is just compressed. But if your drug is not very stable in that compression, in that high pressure, in those cases capsules become important. And again, you can get them at various sizes. Each of these sizes has their own code. So, you can see them 000, 00, and all the way up to 5. And again, this just defines as to what is the relative size, and then there is also hard gelatin, soft gelatin that you can use as elastic shell for these capsules, which will then once it comes in contact with water, they will essentially degrade or dissolve away. Okay, so we will stop right here and we will continue in the next class. Thank you.